What's going on, everybody? Sorry for all the technical difficulties. We had some issues with getting Amanda added, so we are going to now get her into the invite. And hello, social fam. We got everything coming on. Amanda's going to be jumping on very shortly. And so Amanda has been practicing and going to be celebrating this year 10 years as a naturopathic doctor. So once she jumps in, I'll let her introduce herself, and then we will get into it. Thank you so much. I'm just going to wave to you all. Boop. And I hope everyone is having an awesome day. And we did get the invite going. Thank you, everybody. Hello, hello, hello. So, anyways, about myself, guys, while we wait for Amanda to join, I am your master coach, FST practitioner, fascial wizard, as what people know, and my nickname is Coach Manimal. I have been a coach for 12 years now and a therapist for 10. So these whole live Q&As is to help you guys get a better understanding of practitioners that I believe are very essential and important to your daily health. When we talk about our health, there she is. When we talk about our health, welcome, Dr. Amanda.
Hi,
When we
Manny.
talk about our health, we want to make sure that you guys get a better understanding of how to take care of yourselves. And so I just gave everyone, Amanda, a little bit of a who you are and how long you've been practicing. If you want to introduce yourself, please.
Okay, thanks, Manny. So I'm Dr. Amanda Ng. I'm a naturopathic doctor. I've been practicing for 10 years now. My practice is primarily in Newmarket, York region, but I do see patients virtually as well. So most times I see patients for all a broad spectrum of health concerns, but I do see primarily a lot of digestive health, hormonal health, even chronic conditions like cardiovascular disease and diabetes. So that's kind of what I've been treating as of late. Yeah.
Nice. Well, we'll crack right into it with the Q&A. And again, thank you guys for all of your patience. Technical difficulties are always fun with technology.
Yeah.
So, question to go. What is it as a naturopathic medicine that interested you versus the other fields of medicine?
So when I was in school and trying to figure out what I wanted to do as a career, I kind of flip-flopped between a number of things. I knew I wanted to go into healthcare. I just didn't know in what realm and, how that would look like for me. There was a part of me, there was a time in my life where I thought I would go into teaching. I was interested in teaching the sciences. There was a part of my life where I thought I would go into pharmacology or pharmacy. So I did work for a number of years as a pharmacy technician. So being in that field, I got to get a taste of what conventional medicine would kind of look like, working
Great.
with doctors and seeing the medication side of things. And, I couldn't really decide what I wanted to do. There wasn't anything that was really drawing a passion out of any of this. And then somehow I landed on naturopathic medicine, and just reading the philosophy of naturopathic medicine really resonated with me.
Great.
And it was interesting because, reading into the philosophies, there's one being doctor as teacher. And I thought, well, that kind of, pulls
Yep.
into where I would love to do some form of teaching. And then just being in the medical field, but also recognizing the traditional medicinal practices as well, and not just the pharmaceutical side of things. What I thought was really eye-opening working in the pharmacy was just seeing how there was a lack of other principles of health,
Okay.
where there was a very large focus on pharmaceuticals, and I noticed patients were not being educated on all the other building blocks of health, which is your diet, your
Yep.
lifestyle. Nobody was paying attention or even learning about any of those things. And I thought that was a big roadblock in healthcare. And I thought naturopathic medicine really put everything together. There's that holistic point of view.
Yes.
Um, and again, it doesn't have to be one or the other, naturopathic medicine or conventional care. We really recognize when conventional care and pharmaceuticals can play a role. We're not against
Absolutely.
it at all. So I liked naturopathic medicine because it encompasses all of those things, right? All the building blocks of health, um, the really nitty gritty medical side of things, but also embracing the traditional medical practices as well.
Absolutely. Even being on the fitness side of it as a coach, there is such a disconnect from the medical side coming into the fitness world. Whereas
Yes.
naturopathic, you guys are like, oh, you have a coach who's helping you. You know, what's their background? Are they a nutritionist? Are they a dietitian? And I have found, just like yourself, we're always the ones that want to work with the medical field. And we're like, yeah, medical intervention is sometimes a necessity. Even sometimes pharmacology is a portion that, it is a necessity depending on what your ailment is and what you're battling. So I completely agree. And what I'm liking is that, as a naturopath, you're not naturopathic doctor. You're not saying absolutely no, this is one way. It's no, it's a holistic approach. And yes, eventually we would love to see either a reduction of that drug that is being given. But back in the day, I used to be a receiver for a pharmacy, and it is true. The amount of stuff that comes in where people are not given that information and the lack of education, and they don't even ask, and it's just here, take this 3 times a day. What is this? Well, you can research it online, and you'll
Yeah.
find that one pharmacist assistant that gives it like a little bit, just
Yeah.
because of the fact that she or he personally cared. So I find
Yes.
it so fascinating that that's where it comes from, and it doesn't come from, and they're not even told, hey, to take this with food. Well, what type of food? And sometimes the
Yes.
pharmacist doesn't even know, right? So it's a lot of times also it's gut before brain, right?
Right.
So let's just pump you with pharmacology and let's see how your gut responds, but yet you're going to be festering more issues, which would then be leading into those mental ailments as well.
Yeah.
Great answer. Number two, do naturopathic doctors have education in pharmaceutical medicine?
Yeah, so we do get some education in pharmacology within the naturopathic program. So I remember, the naturopathic program may have changed since I have left the program, but in my day, and I'm sure it's still in part of in the curriculum. Sorry, um, there were at least two courses, or you would spend at least 1 year learning about pharmaceuticals. And we're not obviously going in as depth as a medical doctor would be, but we're um, taught about the most common pharmaceuticals that are used for the most common ailments, right? So,
Right.
colon foods, cardiovascular disease, diabetes, all of those things. We would learn about all the drug classes because, you know, any patient that can walk through the door, they could be on medication, even though we don't
Yep.
have the capability of prescribing medication or changing their medication. We need to be aware of what they're on, what could the potential side effects be if we are prescribing, say, supplements or anything like that. Are there
Yeah.
any interactions? So we need to be aware of those things. So we do get that background. Um, Outside of the naturopathic program, being a part of the College of Naturopathic Doctors in Ontario, they have a separate standards of practice for therapeutics and the ability to prescribe certain types of medication or certain minerals or vitamins in higher doses. You have
Right.
to write a particular prescribing and therapeutics exam in order to have access to prescribing those types of drugs they would call. So studying for that exam, you're required to learn about, again, a little bit more in depth of all the pharmaceuticals. You're given the pharmaceutical drug compendium to learn from. So
Right.
again, there's that additional learning that's there as well.
And I think that that's a great tad bit of knowledge for people, because what I find is that the skepticism of the general
Mm-hmm.
public is that naturopathic doctors don't know, and I
Yeah.
think that's such a stab, because it's like, no, no, I know what I'm going to be helping you with, minerals and supplementation wise. I think the missing gap, and I'm curious to ask, is do you and your colleagues find that if, say, for example, you have a client who is on, let's just say, certain pharmaceuticals that are for mental ailments or diabetes or any gut stuff, do you find that when you guys try to talk with the MDs or their GPs, so their doctors or their general practitioner, that you don't get a lot of that support back?
I say it's 50-50.
Okay.
Some medical practitioners are open to naturopathic care and some aren't.
Right.
It really depends on the practitioner and how open they are.
Yeah.
I would say, yeah, it's about 50-50. 50% of my patients will say my medical doctor, my family doctor is open and they say, go ahead. Good part of,
Nice.
naturopathic care is a good part of the team. And unfortunately, the other side says, well, you shouldn't be doing that, or there's no
Yep.
interest. And again, not to shine a negative light on
Not at
the
all.
medical field,
No.
but yeah, we're not quite there yet in terms
Yeah.
of full acceptance into the conventional medical
Yep.
field. So again, when there is that side of where the patient's doctor is not particularly open, like I
Yeah.
said, we're not changing their medication. We have the conversation of what particular supplements or anything like that could be a good complement. And again, discussion about interactions and stuff like that, what would be contraindicated. If that patient, sometimes in certain cases, if that patient says their goal is to come off of medication, we have that conversation of what would, say, a schedule look like for tapering a medication. Again, we don't have the ability to do so. It would have to be a conversation with their medical practitioner, but
Right.
we can support them once they have the go ahead and the guidance with their medical practitioner for tapering meds. We can give them the guidance they need to help with mitigating any potential withdrawals or side effects or anything like that as they're coming off of them.
And see, that's amazing, because I agree that in the last,
Yeah.
I would say probably in the last 5 years, that as a nutritionist, so not a dietitian, as a nutritionist, even trying to give advice or even wanting to have a conversation with the general practitioner or their family doctor, it's not as, I can at least get emails now going
Mm.
on, and if someone is going to see a sports chiropractor, there's not so much of a drawback from the medical side, which has been really helpful, because
Mm-hmm.
10 years ago, not being a doctor, being a coach in my field for as a master in that field, it's taken some period of time for people to be like, well, hang on, don't take these pain meds. Actually, go see somebody who might be able to first help you. So in that situation, I can relate that it has definitely expanded into they're more willing to listen with us and at least have a
Right.
conversation. But no, I would say we're still not at,
Right.
it's all it's a grand spectrum, and it's, I don't know if you find this, but it's almost like, oh well, why did you go to them, right? And it's not
Right.
even shedding a negative light. It's like, no, no, no. Your patient, your client, whichever you want to say, is the person, is we're trying to help them as a whole,
Right. Right.
right? And
Yeah.
so, go ahead.
And I was just going to say, what I always tell my patients is you want to have you want to have a health team, right? It's
Yes.
good to have a team. Not one practitioner can do everything.
Yep.
And I recognize, again, I don't have, for example, the pharmaceutical knowledge. The
Yep.
medical doctor does.
Correct.
The medical doctor may not have knowledge in supplements or dietary modifications, but I can help
Correct.
with that, right? So having that health team is really important, and we should be working together in collaboration versus against each other, right?
Yeah. Yeah. Big time.
And that's where the struggle is. Part of that struggle is right now just being recognized. And again, we're not trying to take away from the medical profession. We're trying to
Correct.
add to it, right?
Yep. Yep.
Yeah.
And I think you guys are doing a great job. It's been awesome to see the growth of naturopathy in general, but as a
Mm-hmm.
naturopathic doctor, that there is more, I'm getting more clients that are like, oh yeah, I am seeing a naturopathic doctor that, I've been able to reduce some of the heavier pharmacology that, I'm getting put in my system, right?
Mm-hmm.
So
Mm-hmm.
so I am seeing the benefits coming across the board, and I am hearing that more doctors are like, oh yeah, go see such and such, right? So
Yeah.
it is awesome that way. Coming on to number three, what are your top five recommendations for healthy lifestyle living that you would advise for the general public?
Yeah. So that kind of makes me think about those building blocks of health that I talked about, right? So,
Right.
since we already touched on health team, because I think that's definitely one of them. So we'll say one of them being having a health team, having many practitioners helping you on your health journey.
Yeah.
Whether we're dealing with an acute or chronic condition or we're working on preventative medicine. Um, so that's one thing that's really important because, again, recognizing that one practitioner can't do everything, right?
Yeah.
And we work well in collaboration with each other. So I would say that's one. Two, so going into more of those building blocks of health. So some of this might seem like common sense, but it's always worth, mentioning is having a balanced diet, right?
Yeah.
Not everybody thinks of that. Sometimes we eat in a rush. We're trying to get out the door, but focusing on a well balanced diet that works for you. Um, we can go in. We don't need to go into the details of what kind of diet, but if there is
Yeah.
any diet out there that could be beneficial for the general public, a Mediterranean type diet, right?
Yes.
That's
Yep.
the best one that actually has the most research for
Yes. Yep.
general health and wellness for the general public.
Yep.
I would
I'd agree.
say number three would be physical activity or exercise, right? Again, going along with the building blocks of health.
Yep.
Um, that's kind of a no-brainer. Making sure we're getting adequate sleep, right? That's something that everybody needs to
Yep.
work on. Whether, we have the, habits of staying up late or people are struggling with insomnia, we really want to work on making sure we're getting um, a good night's sleep, right? 7 to 9 hours on average for
Yes.
the general individual.
Yep.
So what's that? That's four. Um, I would say stress management, again,
You nailed them.
good
Yeah.
building block of health. And within stress management, it's, finding what brings you joy in your life and making sure you're participating in those types of activities, right? So,
Yep.
what brings you joy? Is it hobbies, being around people that you like? So, there's that socialization aspect. It doesn't have to be one of those things, it could be a combination of those things.
Yeah.
And then from stress management, identifying what is that stressor and how do we cope and manage and what are those strategies we can have, because again, we can't get away from stress. There's always going to be stress in our lives, so
Yeah.
how do we equip ourselves with managing it effectively?
Yes, big time.
Yeah.
And I think just something that I would tail into that, I completely agree about the Mediterranean diet. Not every nutritional way of life that you want to live or diet, but the term diet is such a negative in society. But
Mm-hmm.
realistically, I think it's the healthiest one that's out there, especially from a broad spectrum. Me myself, I'm a gluten-free vegan, and when people join the team, people are like, well, how do you manage what you do? And it's like, hang on, this is what I find works best for me, right?
Mm-hmm.
You do a little bit of a process of elimination, listen to your body, right?
Exactly.
But, and it's, if it's gluten, if it's dairy, those are the two that I usually say, try a week or two, just don't have it. And then reintroduce it. And that's still not even a long period of time,
Right.
right? When you're really looking at process of elimination. But people are like, oh, well, my skin, my gut, my
Hmm.
bathroom. It's like, that's your body. And I think that's, you touched on it, that social interaction is so important. Just being able to talk. And I think learning with stress management, it's, guys, being a man myself, we don't talk enough. As women, there's such a collaboration with each one another. And I
Hmm.
think men really need to step into that realm as well. Being able to talk to your partner, that's another
Hmm.
big thing, both sides
Hmm.
too.
Hmm.
And it's vulnerability with your partner is also a big one that I think people need to, if there's one person you should be able to have that with, society is really changing that right now. And I think partners
Right.
need to be able to have those tough conversations, especially when it comes to how to manage stress. But
Yes.
you nailed it. And sleep, absolutely agree with that. It's something where, if you're getting 4 hours of sleep, like that's number one, right? You got to get to, you said the number perfectly too, 7 to 9 hours per individual. Men,
Hmm.
yes, we can function on 6. Women, 8 to 10 if you can,
Right. Right. Right.
right?
Right.
It's so no, awesome answer. So when we're coming into it, number 4, it's a little bit now transitioning to the, we're going to have 4 and 5 going into men and women now.
Okay.
What are your top 3 supplementations slash minerals that you would recommend to a woman to support health and fitness?
Um, so for a woman, one that comes to mind would be if we're thinking health and fitness, creatine is a big one.
Yeah.
I work with a lot of women who are in that perimenopausal transitioning into menopause, postmenopause phase.
Okay.
And if you think about it, that's a big age range, right? Like
Yes, it
40
is.
to 60, 65 and over.
Yep.
Um, so I would say creatine is one of the big ones there. We've seen a lot of research coming out more recently on the benefits of creatine for this population of, perimenopausal,
Yep.
menopausal women, where, for women in this transition of life, we're seeing those changes in body composition, right? So there's more fat deposition, less lean muscle mass, and we want to preserve that lean muscle mass and
Absolutely.
maintain it. So creatine really helps with that. Um, and again, thinking about it's always thinking about prevention as well, right? In
Yep.
those postmenopausal years, we want to maintain that muscle mass because we're also thinking about the loss of bone density at that time,
Yeah.
that increased risk of cardiovascular disease at that time of life as well.
Yep.
And then again, you're thinking about just the aging population. There's more being more prone to slips and falls and fractures, and that lean muscle mass is going to protect from that. Those types of things from happening, right? So we want to work on building that lean muscle mass now in those earlier years, so you're
Yes.
ready to thrive in that, third part of your life. It's that last third of your life, right?
Yep.
So creatine really helps with that. And again, in that pre and postmenopausal, in those pre, peri, and postmenopausal years. Creatine also shows benefits for cognitive health, mood regulation, and all of that
Yeah.
too,
Yep.
right? So,
Yep.
again, a lot of studies coming out for menopause, and we're seeing the benefits of creatine for that. Um, was it what top three supplements
Top
you
3.
said?
Yeah. Top 3.
Okay, so one that would be on the list would be protein, right? So
Yep.
protein intake is really important, and trying to get it through your diet, it can be done, but sometimes there could be challenges in getting
Yes.
that adequate requirement. So a protein powder can be really helpful, right?
Yep.
On average, a scoop of protein powder is about 20 grams of
Yep. Yep.
protein, depending on the brand that you're purchasing. But
Correct.
that can really help you get your target for the day. So I think
Big
on
time.
average for just the general individual, and this actually applies to men or
Men
women,
too. Yep.
um, I think it's zero point 0.8
Yep.
grams per kilo per day of your body
Yes.
weight. And
Yep.
then if you are more of an athlete, then we're looking at 1.4 to 2 grams per kilo of body weight per day. So again, depending on your requirements and your lifestyle, protein powder can really help with hitting those requirements. And again, it's that protein that helps with building that lean muscle mass. And then also just for getting the calories that you need for the day,
Oh,
sugar regulation, you
yep,
know.
yep,
And
big
again,
time.
I always talk about sugar regulation with my patients. You don't need to be diabetic or worried about being pre-diabetic. Everything depends on sugar regulation when it all
Big
kind of
time.
boils down to it, and protein's there to help you. Um, for the third one, I would say we can probably say a collagen could be beneficial as well. If we're looking at just overall health and wellness, collagen can be really helpful. Again, I'm thinking about that perimenopausal aging population. So collagen's beneficial for hair, skin, and nails.
Yep.
There's the benefits for bones and joints and all of that as well. Collagen also helps with gut health at the same time. So I would say collagen would be a good one to add into
Um,
there.
Those are awesome. I
Yeah.
completely agree. There's a lot of confusion right now about if creatine's safe or not. I will definitely support those answers, all three of them. Creatine, guys, has been the biggest study supplement in the health and fitness.
Mm-hmm.
Massive benefits. Amanda hit them all when it comes to your gut health, your muscle health, your cognitive health, keeping that muscle memory and keeping that muscle firm and making sure that it is staying as that lean is absolutely essential. Dr. Amanda touched on some very key parts as we are aging in the generation. The highest factors, both men and female, after the age of 45, a lot of women will start to have knee issues because of lack of development in their quads and in their buttocks.
Mm-hmm.
Men, it's a lot of hip issues. So yeah, it's actually one of the biggest supplements that I truly support for my females and also my males to making sure that they are keeping that. There is more studies as well for the support that it is actually beneficial for the cognitive ability, and actually latest now is actually helping in reduction and preventative for Alzheimer's and dementia as well.
Mm-hmm. Mm-hmm.
So, there's a lot of benefits to that. Next one you touched on is protein. You got the numbers right on the ball too, which I love to hear. You heard it from a doctor herself, guys. It's protein is absolutely essential. I would find my female patients, especially clients, that they're just not eating enough, right? And there's always this fear of, oh my God, I'm gonna get big and strong, and I'm gonna get bulky, and it's not the
Right.
case, right? I think food is such a hard it's an emotional topic, right?
It is.
And it's when we have so many females that are trying to lose weight, they think if I'm going to eat more meat or I'm going to eat more protein, I'm just going to get big, and it's like that's not the case at all, right? You're building blocks for your protein to make sure that you're maintaining that muscle, and especially that lean support. And collagen is great. There's many that are out there. There's going to be your bovine, your marine, and now there is plant-based as well.
Right.
What I always like to say is use what works for your body best.
Yep.
There is no top brand. It's you have to try it and see if you notice it, and you have to give it a period of 1 to 3 months. Everybody, you can't just try
Yeah.
it for one. I'm going to have one bottle or I'm going to have one powder and I'm going to see how it works. It's going to take any supplement that you guys are taking is going to take at least 3 months so that your body can actually. Would you agree?
Yeah, I would say general rule, especially with any supplementation, giving yourself a good 3 months of routine intake.
Yeah.
Because, yeah, it takes your body some time to use up and utilize what you are taking. Again, very different from the effectiveness and efficacy when you're seeing pharmaceuticals, which obviously probably work much quicker, right? So there's
Yes.
that expectation to have and being patient, right?
Yes. Yep.
Yeah.
Big time. We got a question that came up during the thing. So,
Okay.
which protein powder is best to use? Whey, vegan. There's so many more that are out there.
Yeah.
What would you recommend for someone who's asking?
I would say kind of along the lines of the comments you made with collagen, just figuring out what works best for your body and what you feel good on. If you don't have any dietary restrictions, if you're not um, sensitive to dairy or anything like that, whey protein is a really good one. You know, it's readily bioavailable, it's easily absorbed.
Yes,
Whey protein is the best way to go if there are no restrictions and no
yep,
sensitivities.
I'd agree.
Um, and if you are vegan, then, you know, turning to the vegan proteins, again, working with what your body feels best on, as long as you're getting that protein intake, right?
Yeah. And so Amanda touched on it. It is very hard, male and female, to get that protein intake in. And if you have to take a shake or two to make sure that you are hitting it, just always make sure, guys, that a protein supplement is a supplement, right? So if you can always aim for the whole food, always try going for the whole food. As I try to tell my clients, is that, you know, if you're in a jam and you can't make something, grabbing a quick, and also what you're taking with that protein at that time also can help with that insulin response as well,
Right,
right? So if you have like a fibrous fruit compared to like a carb fruit, like a
right,
banana with the shake or an apple with the shake, that's going to help sustain where that protein source is going to go. So I'd always
right,
recommend like an apple, sometimes even before your workout, if you're an afternoon or evening workout. And if you want to get more glucose and protein synthesis happening, then have that with that banana post workout and
right.
then treat it like a snack.
Yeah, that sounds good.
So when we're talking now for the men, what would be
Yeah.
your top three?
It's funny because there's a lot of overlap, right? I would say
Big
for
time,
men
big
and
time.
women, there's the creatine and the protein. The men
Yep,
can benefit from the collagen as well.
yep,
You know, the more that I think about it, I don't really have any differing um, recommendations for men specifically when we're talking about fitness. You
yep,
might have other ideas, but if I was going to add to the list, this which would be beneficial for both men and women would be magnesium is a big one as well. Magnesium helps with muscle recovery, and there's that overall benefit for the nervous system for relaxation. You know, people can benefit from taking magnesium in the evening to help
yep,
with getting a good night's sleep. Magnesium can help with, you know, bowel movement regulation and all of that. So a
yeah,
lot of
yep,
benefits with magnesium. So you get the muscle recovery, you get the digestive support, the nervous system support. So magnesium is there as well. Is there anything that you would recommend for men specifically?
I think it's, you know, it's an interesting topic. I would say you want to go, and this is now we get back to the medical side, even yourselves, because you guys can correct me if I'm wrong. You guys can help with blood work,
Yes.
is testosterone levels in men.
Yeah.
I would say even for women, you know, I'm
Yes.
gonna bring, there's much more overlapping because a lot of times women think, oh, my estrogen is, you know, where it should be. I think men and women need to know where their hormonal blood levels are.
Yeah.
I would say that's something that is very masked, and unfortunately, in the medical field, you know, just for simple numbers, if a man is supposed to be feeling good at 20 and he's
Mm-hmm.
at an 8 in his testosterone level, they'll say no, that's healthy. And I don't
Right.
think there's enough education, even for women, when you're talking your proestrogen, estrogen, and testosterone levels. That is all up in the air. There's not enough education given by the medical field that I think this is where you guys can really help to educate. And
Right.
it doesn't have to just be, oh, go on this pharmacology route. There is way more supplementation that you can really get. And even just when you're talking nutrition involvement. Magnesium, I would completely agree too, is that there's so many different types of magnesium.
Right.
You know, you go into the health food store and you're looking at biglycinate, magnesinate, and when you're looking at all these different types, you're like, oh my God, which one is for which? Is there ones that you would recommend specifically? Because we touched on it earlier about sleep. Which one of the magnesium would you recommend is best for sleep?
The one that I generally recommend and I tend to gravitate towards is the magnesium glycinate, or sometimes also called bisglycinate. It's
Yep.
that glycine that has that inhibitory calming effect to it. So that one is really helpful for that muscle relaxation, nervous system relaxation as well. There also is the benefits with magnesium threonate. So the threonate helps with that magnesium to actually cross the blood-brain barrier. So that could also be helpful for sleep as well, and just helping with cognitive support and all of that if we're thinking further down to um, Alzheimer's and cognitive decline. Yeah, definitely having a practitioner to help you differentiate between all the magnesiums and which one is helpful for you. That can definitely be helpful to have somebody help you out with that. And just going back to when you're talking about blood work, I totally agree when we're thinking about just overall health and wellness for men and women, looking into hormonal profiles and all of that. And again, we're able to give both men and women the proper guidance as to when you should be testing your particular hormones rather than getting a requisition and just going at any time of day or any time of your cycle for a
For
woman,
women. Yeah.
right? So there are specific times for a woman in her cycle to be testing her hormones and to get an accurate measure. If we're thinking about testosterone, we want to be testing in the morning for men or women because morning is when testosterone levels are at its highest. So again,
Yep.
it's important to know when you should be going for this blood work, whether it's that time in the cycle or that time in the day.
Yeah.
So we can definitely give you guidance for that.
No, that's great. It's so true too, because a lot of this isn't well known, right?
Yeah,
And even when you come for blood work, like I just had a client of mine be like, so I went for my blood work and they didn't tell me that I had to fast,
right.
and it's like there's that missing link where I think it's so beneficial to have someone like yourself give that proper education of when is the best time,
Mm-hmm.
especially when we're trying to figure out your hormone profiles is such a first off it's not talked about, right? And it's almost like it's an ask, or it's at certain times they'll allow you to get it, and I think it needs to be a little bit more accessible.
Right.
This is where I think naturopathic doctors like yourself, you guys aren't going to be like, well, here are 5 questions as to why do you want this. It's not just, I just want to know where I'm at. And I want to be comfortable with I want to know where I'm at in my life, right? I
Right.
want to know if I'm balanced. Whereas what I have found is that it's very difficult to even get some of that stuff. So I think bang on, girl. Moving on, when we come on to number 6, how often would you add? Great question. How often would you recommend seeing a naturopathic doctor?
Again, I think it depends on what concern we're dealing with, but on average, when I'm thinking about the patients in my practice, once they come in for their first initial assessment, I'd like to, on average, see patients every 6 to 8 weeks to start.
Yep.
So we would get the ball rolling on, what's the treatment strategy? What are the things we're implementing? And then seeing them every 6 to 8 weeks. Um, did I say 6 to 8 months?
Yes, you did. No,
Sorry,
6 to 8 weeks.
six
No,
to
no,
eight
6 to 8
weeks.
weeks. No, you
Six
did.
to 8 weeks. So we're saying 6 to 8 weeks here. So in the beginning, to make sure that that patient is able to adhere to this strategy. So there's that sense of accountability,
Yep.
making sure we're able to troubleshoot if there's anything that comes up. So say, for example, is there an adverse reaction, a side effect, or does, say, for example, does the exercise routine that we agreed on, maybe it doesn't actually work for them? How can we troubleshoot and make that, fit better into their lifestyle?
Big time.
So coming up with strategies and having that conversation. So trying to keep up every 6 to 8 weeks. And then if we're thinking about hormonal health, if we're trying to make changes to hormones, we
Yep.
got to be diligent in keeping up with our strategy for at least 3 months. So sometimes I will see patients in that, we won't follow up till about 3 months time. But again, sometimes patients do like that accountability and check in halfway through. So
Yep.
that's that option there. Once we are on the path to where we want to be, once we get from point A to point B, we're seeing our benefits and whatever concern we're dealing with, we can space out our appointments further apart. So it could be anywhere between every 3 to 6 months. Once people have a good handle on whatever it is that we're working with. They're happy with where they are. It could be a check-in every 6 months, a check-in every year, quarterly maybe.
Yep.
If we just want to make sure that the ball's rolling, work on maintenance, or even address maybe potentially new things that have come up. Sometimes I'll say, we'll check in yearly because there are cases where I do become that primary care practitioner where I'm doing their yearly blood work.
Okay.
So we would be checking in that year's time. So it varies in terms of follow-ups, but yeah, on average in the beginning, every 6 to 8 weeks, and then we can pretty much space things out for maintenance moving forward.
That's awesome. I didn't know that, guys. So,
Yeah.
guys, thank you again so much for joining us. For those that are still coming in and out, I'm here today with Dr. Amanda, the Naturopathic Doctor, and she is giving us some great answers to some questions that I thought would be great for myself to know, and also for all of you guys to figure out some great info for yourselves. So coming on now to number 7. This is more a little bit related to my field. And so in the health and fitness industry, a big obstacle coaches and practitioners battle is clients managing their stress. We did touch on this a little bit
Mm-hmm.
already. What tips or tricks would you recommend for people's management, and how to actually get a handle on those daily battles?
Yeah, so basically, the first step would be identifying what the stressor is. Sometimes people just feel this general sense of stress, but they can't exactly tell you why or where it's coming from. So sitting down and actually trying to identify where is it coming from. Is it the workplace? Is it the dynamics of family at home? Any other relationships going on? It could even be physiological stress. Are you fighting an infection? Are you not sleeping well, right? So trying
Yep.
to identify where it's coming from and then coming up with coping strategies from there, right? So
Yeah.
if you're not sleeping well, why is that? Is it the work stress? Then how do we disconnect from work life to home life, setting that boundary and
Yep.
allowing you to get that nervous system come down from that excitable response, that high stress response, so you're able to wind down for the night. So that's kind of a general example.
Yeah.
And then, going back to having a good healthcare team, talk therapy, a psychotherapist, a psychologist, those people can be a really great form of, a coping strategy.
Big
So,
time.
again, you're talking about being able to talk to one another or having people to talk to, socially, your partner at home. Yes, you can utilize those support networks, but sometimes you need that external support that has a more objective
Yes.
look on your life. And, talk therapy, a psychologist, psychotherapist can be really helpful. And sometimes people find it a lot easier to open up to somebody like that.
Yep.
There's more opportunity to be vulnerable because there's less potential perceived judgment coming in, right? So, and they can help you really get a handle on what are those dynamics in your life that are promoting this stress response and how can you come down from that, right? And giving you coping strategies, working on those things with you. And that would be ongoing treatment with them, right? Whether it's monthly, every couple months, whatever it looks like for you.
Big time.
Stress management, again, there's that whole building block of health with making sure you're getting adequate sleep, right?
Yep.
While you're sleeping, that's when you're healing and regenerating from the inside out, right? So
Yes.
whether
Yep.
it's physically, your muscles are regenerating after a workout,
Yep.
or your blood sugar regulation takes place in the evening as well while you're sleeping. And then again, we're thinking about hormone regulation as well, cortisol as well. There's this diurnal, what we call a diurnal variation of hormones, right? There's a cyclical nature that depends on daytime and nighttime, right? And
Yes.
when we're thinking about stress, cortisol regulation also is influenced by a good night's sleep.
Yep.
Cortisol, to be very general and to just give a quick education about cortisol is cortisol levels should be highest in the morning and then
Yes,
slowly
easing off.
decreases throughout the day, right? So if we're experiencing high stress in the middle of the day or in the evening, all our cortisol levels are going to be kind of wonky throughout the day. So we want to make sure we're able to regulate that. Sleep is a great way to do that,
Yep.
and help with that, decline in the night and that increase for the morning to get you up and going, right?
Yes, big time. I think one of the biggest factors that I find is that dealing with men or women, we can't fight stress by adding a physical stress. A lot of people ask, well, Manny, my stress outlet is me going to the gym or hitting the bag, and it's like there's an education again, right? Cortisol is a big one. We can't keep spiking. If you don't want to affect your serotonin levels, you don't want to affect any of your. Geez, we can talk about hormones for a bit, but no, like going back, keeping it to the point here is you want to make sure that you're even adding in an NLP practitioner, so a neuro linguistic programmer, right? If
Mm-hmm.
you don't like talking to a psychiatrist or a psychotherapist, is knowing where to get that talk, that conversation out. Stress and adding exercise, especially intensive exercise, going for a walk
Right,
can even benefit. It doesn't have to be, I need to go lift some crazy weights in the evening because I'm stressed out from work. Sometimes just taking a 5, taking 20, and just doing a simple walk just around the neighborhood, going to the park, to getting away from technology.
mm-hmm.
There's so many ways that we can combat the daily stressors and really just so your central nervous system, your CNS guys, getting that fight or flight response, getting that PNS, that parasympathetic system to
Right,
deregulate. Right. Sometimes driving home from work, it's changing that cranking, pumping music, jamming, right? And actually, just some people will do it. They'll listen to some binary beats on their drive or classical music and just kind of take that BS that you get from work and kind of flush it out so that when you get home, you're not taking that energy and that
right,
that stress with you, right? Because your kids scream, they throw something on the floor. You're just then again building and building and building.
right.
So always take that 5 minutes, even if you get your drive home, you dealt with traffic and you dealt with that BS. Take that 5 to just diaphragmatic breathing or Buddha breathing, right? Big inhales into the belly and exhale through the mouth. 3 seconds in, 7 seconds out, and really deregulate your what I like to call our daily composition of our bullshit.
Yeah, yeah.
And it's
Decompress. Yeah,
correct. And I think that even just learning what you nailed it on the head again is what are those stressors, identifying them, and learning how to cope with it, even sometimes by yourself, is a great way. And then adding in those, you nailed it again, that health team, right?
right,
And not being afraid to reach out to them. I think that's another big thing too.
right.
All right, we're coming down to the last few.
Okay.
Um, in the health and fitness and naturopathic field, a growing treatment is minerals and vitamin injections to combat muscle stiffness, stabilizing stress overload. We did talk about this a little bit, and no, it's not specifically what you do, but you do know about getting certain mineral drips is important for just health. What is your
Yeah.
thoughts on that? Because I'm noticing as well, as we talked about it a couple weeks ago, it is still booming, and it's more and more people are talking about, well, for my skin care, my gut health, getting drip.
Right.
What is the big premise on getting drips?
Yeah, so yeah, these aren't the types of practices that I perform in my practice
Right.
specifically. And what you are allowed to do really varies between which jurisdiction, as a naturopathic doctor, that you're within.
Yeah.
Um, with IV drips, you need to, in Ontario, you need to fulfill a specific standard of practice, write an examination for IV therapy. IV therapy can really be beneficial because you are bypassing the gut essentially, right?
Right.
Versus, when you are taking an oral supplementation, um, an oral supplement, you would be having to digest it and your liver needs to process it, right?
Right.
Sometimes your liver is deactivating the supplement, sometimes the liver is activating the supplement, depending on what you're taking. When you are taking in vitamins or minerals through IV, you're bypassing all of that digestive tract and liver,
Yes.
and you're just getting it straight to the cells and the tissues that need them. And that can be beneficial because it's quicker delivery. And
Yep.
then in the cases for, say, for example, someone who has, inflammatory bowel disease, who can't, those types of patients can't absorb efficiently or
Right.
effectively because they're so inflamed. An
Right.
IV drip is one of the ways you can get things into them, right?
Yeah. Great. Yeah. Great.
So, and again, when we're thinking about fitness and athletes and recovery, an IV drip after a really hard workout, a competition, a marathon, or anything like that,
Yes.
that's really popular afterwards because it's just delivering straight to the muscles and tissues quickly when you absolutely need it in that recovery time.
I think that was great. Sorry.
Yeah,
Yeah.
I was
No,
just
that
going
was
to touch
great.
on one more thing. So it's not within the Ontario jurisdiction. Um, I do know that it can be performed in Alberta. There's prolotherapy.
Oh,
So
okay.
it can't be performed by a naturopath in Ontario, but by a naturopathic doctor in Alberta. There's prolotherapy where you're basically injecting it could be vitamins, minerals, any types of substance into the joints, into the ligaments or tendons
Oh.
surrounding the joints to help with not just muscle, but all that tissue healing and regeneration. If there is an injury,
Oh,
can
okay.
help with mobility and, joint performance and stuff like
So
that.
tendons, ligaments, good old meniscuses.
Yes.
Yeah. No, that's awesome. I didn't know that. So that's actually pretty cool. So hey, if we gotta go to Alberta, let's do it.
Well, I'm
It
sure there's other practitioners here that can do it. We, as a naturopath, we can't.
not yet.
We'll see.
Yeah. Okay. You're still good for time?
Yeah.
Perfect. Coming down to the last two questions. In your general care and day-to-day treatment screenings, what is the biggest obstacle you're seeing with your individuals? And what are some key tips to give those battling the same type of obstacle or obstacles?
Yeah. So reflecting back to what we discussed at the beginning of this video, again, not to shine a negative light on conventional care, but I
Not at all.
do find patients that come through the door, they're not very well supported in the medical field,
Yep.
whether they may not have a family doctor or they do have a family doctor, but they don't get that thorough support that they need. So
Yep.
um, that's one of those struggles and obstacles that I do see where patients come in and say, I don't feel well. I've done my doctor's done all my blood work. They say everything's fine. And they say, well, go about your day. Your blood work looks fine.
Yeah.
But they still don't feel well, right? So I
Yep.
feel like there's none of that additional support that goes along with that. A lot of times patients are just sent on their way, even though they still don't feel well because their blood work looks good, right?
Yeah.
Um,
Yep.
so I find that's quite a big struggle, and people often come to me because they still don't feel well, they don't have that support, and they're just looking for someone who can give them answers, right?
Yep.
And I'm happy to do that, but part of me feels a bit sad that people are coming in at that point
Yeah.
when they
Yep.
could be coming in way before that. They don't need to be dismissed by the medical, field and then come to us. We don't need to be that
That last
last
resort.
resort, really.
Yeah.
We could be part of that primary care team. Again, not to say that nobody needs a medical doctor, but again,
Yep.
having one of us as one of those practitioners on your health team can be really beneficial and not
Big
just
time.
be that last resort. So I find that's a big obstacle there, where there's and it's getting better. There's that lack of education or awareness of how naturopathic doctors can support them.
Right.
So I think just continuing to talk about it and raise that awareness so people aren't waiting
Yeah.
until they're, at their wits end before they're seeking our care.
Yep.
It does, and it doesn't have to be as well being dismissed by the medical doctor. We can do things in collaboration again with each other, right?
Big time.
Um, so I find that's one of those big obstacles there. So I would say, just to sum that up, just not being supported in the medical field efficiently or appropriately, and then just not knowing that there's that naturopathic option that can be of support. And I also do recognize that, naturopathic care is not covered by OHIP. So sometimes that is a big obstacle there for
Yep.
anyone who may have those financial restrictions. But
Yep.
knowing that there's a lot of, if you do have private insurance from your employer or anything like that, very often there is naturopathic coverage. So being aware of what coverage there is and being able to utilize that. And if there is no coverage, again, I'm sympathetic and empathic to whatever financial restrictions people have, but kind of putting into perspective that you're investing in your health, right? When you're trying to decide, should I pay for all of these naturopathic services?
Yep.
Think of it as an investment in your health and longevity and health span and all of that, right?
Right.
You're not just throwing your money away to anybody. You're here to provide, as a naturopathic doctor, we're here to provide services so you can heal and thrive. And again, we work on not just working on your current health condition, but we can work on being proactive too. You don't
Yep.
need to come in with a specific health condition. You can
Yep.
come in with just the goal of, how do I maintain my health
Yep.
and make sure that, I'm able to thrive in all my years to come.
Branching to two questions, I think there's going to be a lot of questions coming from this, and I think your answers have been fantastic. Guys, again, thank you so much for joining me and Dr. Amanda, the naturopathic doctor, giving you guys some really good tips and tricks and just overall general education. Um, for those that are struggling with their family doctors or their GPs that aren't helping, where can people find you guys? Is there a directory? Is it literally just go to Google, not naturopathic doctor near me? Would you recommend where can they go to get that support?
So there's a number of places you can look for a naturopathic doctor. There is that simple Google search,
Yep.
see who is in your area. Um, One thing to also keep in mind, and you want to be mindful of when you are researching a naturopathic doctor, you want to make sure that they are licensed and registered to practice wherever you are. So in our case here in Ontario,
Yep.
that your naturopath is registered with the College of Naturopaths of Ontario.
Okay.
Unfortunately, there are people out there that claim they are naturopaths, but
Yep.
they aren't actually licensed to practice in Ontario. They may have gotten their education through an online course or something like that. You
Okay.
want to see that they've gotten their education through an accredited naturopathic college. So
Okay.
in Canada, there's only two. There's the Canadian College of Naturopathic Medicine. There's um, a college here in Toronto, and the next one is in Vancouver, or British Columbia. So just making sure you're looking for practitioners that have that background.
Right.
If you are just doing a general Google search, if you want to be completely sure you're finding an accredited naturopathic doctor, you can actually look up a doctor on the College of Naturopaths of Ontario database. There's a
Okay. There you go,
directory
guys.
there.
Yep.
There's a directory also with the Ontario Association of Naturopathic Doctors, or even the Canadian Association of Naturopathic Doctors. Um, Most practitioners will register themselves on those directories if you need help finding somebody. And then if you do find someone you are interested, it is common for a naturopathic doctor to offer a complimentary consultation, like a meet and greet. So don't be shy to schedule one of those. Have a discussion and decide if you guys are a good fit for each other, and
Yeah,
ask
big
your
time.
questions. Because again, like with any practitioner, you want to make sure you resonate with that practitioner's philosophy. You want to make sure that they're able to address the concerns that you have. And you want to get a good vibe from them, right? And make sure that you guys will actually work well together.
Yep. Yeah, big time. You guys have to feel each other out, right?
Mm-hmm, mm-hmm.
Absolutely agree. And guys, coming down to our last question. So, over the next few years in your practice, where do you want to see the future of naturopathics go and expand into? And what do you find yourself specializing in?
Um, for the naturopathic field to expand in the future, I'd like to see, and I am optimistic that we'll gain more access to diagnostics, right? So,
Okay.
um, whether it's just more lab assessments via through blood work or anything like that. We do have
Yep.
an extensive list of what we can order. However,
Right.
there are still some restrictions there, so hopefully gaining more access to those.
Okay.
And at this point, we're not able to send for any imaging or anything like that, whether it's x-rays, ultrasounds.
Sure.
That would be, it would be lovely to have access to those as well.
Right.
Um, and then even expanding the scope of what's able to be prescribed, right? So whether it's vitamins or minerals in higher dosages, which are considered drugs,
Right.
there are certain medications that we can prescribe when we're talking about pharmaceuticals. Maybe having a little bit more under our belt. And again, this is to recognize that there is time and place for pharmaceutical medicine, right? So, say, for
Right.
example, if somebody comes in with what's really common is a UTI, right? A urinary
Right.
tract infection. If
Right.
we want to get that treated quickly, sometimes an antibiotic is the way to go, right? So, being
Right.
able to have um, acute treatments available
Right.
to us would be lovely. And then just that awareness moving forward of what we're capable of contributing to the healthcare system, right? And I think, being recognized as being part of primary care would
Right.
actually help alleviate the burden that's on the healthcare system right now, right? There's
Big
a
time.
lot of shortages of family doctors. Some people don't have a family doctor.
Right.
People are having difficulties getting their regular blood work done. Sometimes people are just running to emerge because there's nowhere else to go. So
Yeah.
being
Yeah.
recognized as part of the primary health system would actually alleviate, that a
Quite a
significant part
lot.
of that burden. And then, we can, again, having all these tools under our tool belt, we can help the general population, again, in collaboration with all other practitioners.
Yeah. Big time. Big time.
Um, and then the last part in terms of focus, I haven't actually decided. It's been really challenging for me to figure out where I'd like to focus my
Okay.
practice.
Yeah.
I do like seeing a broad spectrum of conditions come in and concerns come in. Um, and when you think about it, when you do put a primary focus on your practice, you still have to be knowledgeable in everything else, right? So again,
Right.
taking the perimenopausal population into perspective. Even if I were to focus on perimenopause, I would still be treating and have to be knowledgeable in cardiovascular health, bone density, cognitive health, and all of that, right? So
Right.
I haven't been able to decide so far. I do like being able to see, the variety that walks through my door.
Big
That
time.
kind of keeps things um, more interesting
Yeah.
in my day.
Yeah. Yeah. Big time. Well, Dr. Amanda, honestly, I can't thank you enough. Thank you for taking the time out of your day to join me in this live. Thank you, viewers, followers. Go give this woman a beautiful follow. Reach out to her. As you said it herself, she is more than willing to help with whatever you got going on. Uh, Amanda, thank you so much for joining. Truly appreciate it.
Thanks,
And
Manny.
I will be posting this for those that haven't been able to fully watch it all. It will be posted on my reels and will be posted on YouTube too. So, Amanda, thank you so much again. Have yourself an amazing day, everybody. And always stay healthy and always remember, keep moving and grooving.
Thanks, Manny. Take care, everybody.
Bye.
Bye.